I believe OHSU is a unique place because it is the only medical school in Oregon. We have not only responsibility of educating ourselves and taking care of individual patients, but we also must take care of the needs of the state. And I think that additional mission makes us a special place.
Daily collaboration and interaction I have with a really fantastic group of residents. It starts first thing in the morning with our fracture rounds at 6 a.m. Both me hearing from the residents about the great work they've done with patients the night before, and then being able to teach back to them about the injury, the patterns of injury, the fracture classifications, and treatment plans.
Well, I was looking at a number of things when choosing a program. One was I wanted a medium-sized program, not too big, so that I didn't feel lost in kind of the shuffle, and we have a good size at 5 residents a year. Also, I really like the fact that we don't have many fellows, so we only have 1 fellow essentially, so you're not competing for cases and learning time and attention.
The quality of education at OHSU relates largely to the breadth of cases, which is vast. We have a catchment area that ranges from as far north as Alaska down to Northern California. I've had routine patients from Idaho. We see a variety of complexity and also a fair number of general orthopedic trauma cases in our own backyard.
We get to work at a level 1 trauma center. We also get exposed to private practice orthopedic surgeons. And I think the fact that it's a mentorship model and you're working one-on-one with attendings, it really helps you to learn from people that are really great at what they do, and you get that personal interaction that I think just benefits you.
One of the unexpected benefits of residency at OHSU is that there are multiple hospital systems on one campus. So one in-house junior resident on call can cover multiple emergency rooms at once. This provides our night float system with a viable way to protect the rest of the residents during the week, so they can sleep during the night, read, work during the day, get the most out of their rotations, and just split up the call on the weekends. My favorite part of my time at OHSU was the mentorship. I think we have the best chairman and program director that you could ask for. Dr. Yu is here at 6 in the morning every morning for sign-out rounds, and Dr. Freese exhibits compassionate patient care for victims of traumas at all hours of the day. They really lead by example, and it's something that we all strive to do.
The 3 points that I think are different from us from every other program in the country are, number 1, it's a collegial place. People get along. It's very common for interns to be calling faculty and faculty to be just teaching down to interns directly. Number 2, we have a mentorship model. As any resident on any rotation, you're going to spend an awful lot of time with one single attending, working hand in hand, day after day on each rotation. And the third thing is surgical training. We believe in having residents in the operating room. 5 years is a very short period of time to learn to become a surgeon, and we want you in the operating room early and often.
We really truly live the mission of the program, which is to become an orthopedic surgeon who cares for each other, cares for our patients, and we do that as a team. So every member of the team understands that we don't do these things by ourselves, that we work as a group to accomplish the goals.
My goal as the residency program director is to turn out really fantastic residents who have a very big heart for their patients. We're looking out not only for their patients first, but the staff and their families around them second of all. And finally, to have residents who are really great surgeons, who are very comfortable with anatomy, comfortable with a large variety of procedures, and know that in their heart they can be great physicians.